We all share a common expectation of how medicine works. You get sick, you see a doctor, you find the problem, and they give you a pill to fix it. It is simple, it is clean, and for a younger adult, it usually works. But what happens when you multiply that process over 20 or 30 years? Most older adults are juggling with multiple health problems at the same time. A pill for blood pressure, a pill for cholesterol, a pill for joint pain, a pill to help them sleep. Add in a handful of over-the-counter supplements, and suddenly you aren't just taking medicine, you are managing a pharmacy. This is a real medical phenomenon called polypharmacy, and today I want to explain why giving a pill for every ill is often the exact reason older adults experience sudden falls, confusion, and hospitalization. Every single medication comes with side effects, but when you mix 5, 10, or 15 different medications together, they start interacting. A drug meant to fix one problem can actively worsen a completely different disease in your body. In geriatrics, we often refer to something called the Beers criteria. It is a list of medications that are highly risky for older adults, and you'll be shocked at what's in the list. It includes very common over-the-counter allergy and cough medicines. And the maths is dangerous. The more medications in this list you're on, the higher your risk of falling and ending up in a hospital bed. Because of this, it's often very jarring for families when they come to my clinic. They bring their loved one in for giddiness or confusion, expecting me to write a miracle prescription to solve it. Instead, the very first thing I say is, let's start by cutting down your medications. And surprisingly, that is usually what helps. This process is called Deprescribing, and it is the bread and butter of geriatric medicine. But I'll be honest with you, it's not easy. It requires fighting deeply ingrained beliefs. Let me give you a real example. I had a patient taking diabetic medication for years. His routine clinic blood results looked stellar. His HbA1c, which is the 3-month average of his blood sugar, was under 3.9%. Now, let me be clear. This is a dangerously low number. But because standard lab reports usually only flag high numbers with a red mark, his dangerously low sugar was never flagged as a problem. I hooked him up to a continuous glucose monitor to see what was happening at home, and I told him to stop all his diabetic medications. The data over the next few days revealed exactly what I suspected. He was having completely undetected episodes of severe low blood sugar. Over time, these hidden low blood sugars lead to falls, strokes, heart attacks, and irreversible cognitive decline. The medication wasn't saving him. It was silently pushing him towards a crisis. Showing him that graph built the trust we needed to permanently stop that medication. If you want to untangle your pillbox, you need a doctor willing to do a deep dive. We look at 3 things. Number 1 is the wean. We identify the harmful drugs like old sleeping pills or pain medication and slowly, safely negotiate a weaning process. Number 2 is the chaos of complicated medication regimes. Imagine managing medications with complicated timing regimes, before meals, after meals, morning, afternoon, or nighttime doses. This almost guarantees medication errors. We optimize for simplicity, such as switching twice-a-day medication to once-a-day pills, and that helps to drastically improve both compliance and safety. Number 3 is the supplements. Look critically at those vitamin bottles. I see so many patients taking overlapping multiple doses of the exact same vitamin or micronutrient. At best, you're creating expensive urine. At worst, it causes organ toxicity. That is money that could be used for actual quality of life experiences, proper dental care, or even physiotherapy. Complex geriatric patients exist outside the clean, clear-cut rules of clinical trials. It takes time to separate the medical facts from the emotional sentiment. If you have an older adult juggling a massive bag of pills, find a specialist who will spend the time to untangle that list safely with you. It takes time that a busy clinic rarely has, but that time is gold. I'm Dr. Lim. Review those medications, and I'll see you in the next one. Bye.